Bismillahirrahmanirrahim. The quote of the day is: if you cannot fly, then run. If you cannot run, then walk. And if you cannot walk, then crawl. But whatever you do, you have to keep moving forward. Today, the topic of presentation is on World Bank and USAID under the kind supervision of Professor Dr. Saira Afzal. The learning outlines of today's presentation is Introduction to World Bank, Members and Voting Power of World Bank, Major Goals, Poverty Reduction Strategies of World Bank, and Criticism on World Bank. The second part of the presentation is Introduction to the USAID, Goals and Functions of USAID, and at the last are the recent updates and MCQs. By the end of this presentation, participants will be able to describe what is World Bank and World Bank Group, how membership of World Bank can be achieved, voting power for World Bank, various functions, and what are the criticisms on World Bank, what is USAID and how it operates. Now, first of all, is the World Bank. World Bank is an international financial institution which provides loans and grants to the poor countries. Loan means that there is always the interest rate on loans, while on grants there is no interest rate. It was created in Bretton Woods Conference in 1944 and its headquarters is in Washington, D.C. The main purpose of making World Bank was to reduce poverty, enhance prosperity, and to improve infrastructure. It was formed to rebuild Europe after World War II. France was the first receiver of World Bank loan of worth 250 million US dollars. After Marshall Plan went into effect in 1947, the World Bank shifted its focus to non-European countries. From 1974 to 1980, the bank concentrated on meeting the needs of people in developing countries. Beginning in 1989, in response to harsh criticism from many groups, the bank began including environmental groups and NGOs in its loan to mitigate the past effects of its development policies that had promoted the criticism. Now, what is World Bank Group? It consists of 5 different entities, 2 of which make up the World Bank. These 2 entities that are IBRD and IDA. IBRD stands for the International Bank for Reconstruction of Development, and IDA stands for International Development Association, constitutes the World Bank. Together, these 2 entities and other 3 entities, it forms the World Bank Group. The other 3 entities are the International Finance Corporation, that is IFC. The other one is MIGA, that stands for Multilateral Investment Guarantee Agency. And the last one is ICSID, that stands for International Center for Settlement of Investment Disputes. These 5 entities forms the World Bank Group, while these 2 entities, that is IDA and IBRD, forms the World Bank. Now, how different entities of World Bank Group operates. The IBRD, that is International Bank for Reconstruction Development, it gives loans on market rate lending to the governments, while IFC, International Finance Corporation, it gives loans to market rate lending and investment in private firms, while IDA, it gives loans to below market lending and grants to governments, while MIGA give insurance and credit enhancements for private investors. Now, how World Bank categorizes different countries on the level on their income. Middle income countries that are again divided into 2 groups, that is low and upper middle income countries. Lower middle income countries are those which has GNI per capita. GNI stands for gross national income, uh, that we can get by dividing the total dollar wealth of the income of the country by its total population. Uh, the lower middle income countries are those whose GNI per capita is between the 1006 and $3955. Pakistan ranks in low middle income countries as Pakistan GNI per capita is about 1200 US dollars. Upper middle income countries are those whose GNI per capita is between the range of 3956 and $12,235, while lower income countries are those whose income is less than 1045 US dollars per year. Now, who are the World Bank top contributors? USA is the top contributor of the World Bank, which constitutes about 16.39% shares of the World Bank. Second is the Japan, who contributes about 7.87 shares of the World Bank. Uh, Americans' shares are the highest, that is approximately double the amount of Japan's shares, while other shares are of Germany, UK, and France that are approximately 4%. The other contributors are India, Russia, and Saudi Arabia, whose contributions are about 2% of the total wealth of the World Bank. Now, who are the World Bank's top borrowers? Mexico, Brazil, Turkey, Pakistan, China, India, Argentina are the top borrowers of the World Bank. Now, who are the members of the World Bank? Only those countries who are the member of International Monetary Fund, that is IMF, can join World Bank. So there are 189 members of IMF. Therefore, World Bank has also the same members of same members. Currently, there are 189 members of IBRD, that is International Bank for Reconstruction and Development, and 173 members of International Development Association. How a country can join World Bank? Countries which wants to join World Bank has to pay a subscription fee. The fee is equal to 88.29% of quota a country pays to IMF. Country which is joining World Bank is bound to pay 195 World Bank shares. One share of World Bank is cost of more than 120,000 US dollars. And if we multiply this amount by 195, that is the shares of World Bank, it comes about $28 million. The concept is that if some country wants to get a membership of World Bank, first he has to get the membership of IMF. To get the membership of IMF, the country has to pay a certain amount to IMF, that is calculated by the wealth of the country. And to join the World Bank, then there is also a subscription fee for joining of the World Bank, that is 88.29% of the quota that the country has paid to IMF. And the country also has to buy the shares of World Bank. About 195 World Bank shares has to be purchased to get the membership of World Bank, and the worth of one share is about 120,000 US dollars. And if we multiply this 120,000 US dollars by 195, its value is about $28 million. So a country has to pay 88.29% of country to to the World Bank, and also have to purchase $28 million shares of the World Bank. Now, who owns the World Bank? No person, organization, government, or nation owns the World Bank. It is an organization made up of member countries, and it is represented by a board of governors. This board of governors governs the organizations, create policies, and appoints executive director. The executive director governs the bank's business and budget and grant loan approvals. The president and managers manage the day-to-day operations. Now, where does the World Bank get its money? The World Bank receives funding from wealthy nations and from issuance of debt securities such as bonds. Which country is the World Bank in? The World Bank is headquartered in Washington, D.C. However, it has locations in more than 130 countries, including Benin, Argentina, and China. And there is also a World Bank office in Pakistan that is located in Islamabad. Now, what is the purpose of World Bank? The bank purpose is to bridge the economic divide between poor and rich countries. It does this by turning rich countries' resources into poor country growth. It has a long-term vision to achieve sustainable poverty reduction. The bank focuses on six areas that are to overcome the poverty by spurring growth, especially in Africa, help to reconstruct countries that emerge from war, provide a customized solution to help middle class income countries remain out of poverty, spur governments to prevent climate change. It helps control diseases such as HIV and malaria, work with Arab League on three goals to improve education, build infrastructure, and provide microloans uh, uh, short industries, share its expertise with developing countries, publicize its knowledge via reports and interactive online databases. Now, what are the objectives of World Bank? First objective or the main goal of the World Bank is that it aims that there should be no more than 3% people who are earning less than $1.90 in the world by 2030. And World Bank is committed to promote shared prosperity by increasing 40% of growth of every country by 2030. Its major investments are in World Bank is currently investing in various sectors worldwide, including education, health, public administration, infrastructure, agriculture, environment, and natural resources. World Bank Whenever World Bank gives loan to any country, it gives advices as well as proper training to private and public sector of that particular country. These advices and trainings are mandatory for the border country to follow. It is not an optional. The main areas of focus of World Bank is to overcoming poverty by enhancing growth, helping countries who recently face war or war-like situations, providing customized solution to help, focusing on climate change, working with Arab League, sharing its expertise with developing countries, publishing reports and maintaining online database. The World Bank also give reports on uh, many sites, as may have listened that World Bank's report states that this and this. Statistics and reports provide downloadable data for more than 200 countries. It is launched in 2010 and a website for 298 major indicators. It includes climate change, health, that includes life expectancy, urban development and infrastructure, labor, income and education, about government, economic policies and debt, poverty, gender and aid effectiveness, business, agriculture and financial area. Now, the leadership of World Bank. The president of World Bank is traditionally an American. That is the main uh, criticism point on World Bank. The president of the bank is the president of the entire World Bank group. The U.S. Secretary of Treasury sits on the World Bank's board of governors, the bank's highest governing body. The vice president of bank are its principal managers in charge of regions, sectors, networks, and functions. The board of directors consists of World Bank Group president and executive 25 executive directors. These 25 executive directors are then divided into 7 and 18. The 7 represents the top 7 big economic countries, while the rest of the 18 represent the whole of the rest of the world. On 23rd March 2012, US President Barack Obama announced that the United States would nominate Jim Yong Kim, who is the citizen of Korea, as the next president of bank. He served 2 terms till 2017. Now, the current president of World Bank is David Malpass. Know the journey of World Bank from 1947 to present. Initially, World Bank is focused on European countries, and after the Marshall Plan came into existence in 1947, it continues serving in other countries. First loan is given to France, that is of worth about $25 million to reconstruct the France after the World War II, and there are also conditions imposed on the France to get the loan. From 1974 to 1980, bank mostly focused on developing countries. Debt of developing countries rose to 20%. During 1980s, structural adjustment program is also came into existence, as some countries who cannot return the loan, then the World Bank imposed structural adjustment programs, that is World Bank formulated policies, and many many policies has been generated in country to so that they can pay back the loan to World Bank. From 1989 to present, World Bank, the main agenda is to work to stop ozone layer. In 1991, work to protect deforestation, and no finance has been generated for any infrastructure project which includes deforestation, and it tries to control diseases like HIV and AIDS. And in 2010, the World Bank announced war on AIDS. Now, the major goals of World Bank. First one is to eradication of poverty and hunger. Second is the universal primary education and to promote gender equality, reduce child mortality, improve maternal health, and combat HIV and AIDS, ensure environment sustainability, and develop a global partnership for development. These are the major goals of World Bank. Now, what are the poverty reduction strategies of the World Bank? World Bank requires documents by IMF and World Bank to give loan. The, these strategies are on these 5 basic principles, that it should be country driven, country driven means that when the loan is given to a particular country, it is for that particular country, and the loan that is given, it should also give results in future, and it should be comprehensive plan and partnership oriented, that both the nations can get benefit, and it is based on long term perspectives. This encourages countries to make poverty focused strategies. Know the climate change and food security. World Bank double its aid for climate change from 2.3 billion to 4.6 billion dollars. 0.8 no there is 0.8 degree warmer than pre-industrial time. No, the atmosphere is 0.8 degree warmer, and it would be 2 degree in next 20 to 30 years. In 2017, World Bank announced that it would not finance any fossil fuel development industry. Global Food Security Program. It is launched in April 2010, and it helps promoting agriculture research, trade of agriculture, and it gives grants to 40 countries for seeds, and the funding increased from 4 billion US dollars to 6 to 8 billion US dollars. Know the conditionality under World Bank. World Bank asks the borrower country to submit some documents. Borrower country basically tells the World Bank that how it will utilize the loan, which it is going to take from the loan from the bank, and how it will pay back this loan to the bank. These conditions encourage the borrower country to devise such policies and technique which would be helpful for it to come out of the poverty situation. Now the criticism on World Bank. World Bank causes inflation as the World Bank gives loans to the countries which are already low income or the middle income countries, uh, and there is also a interest rate on the loan. The borrower country has to increase the prices of the things in their country, and they also raises the tax, so it causes inflation in the borrower country. World Bank is influenced by big power, as the voting power of the World Bank is by the criteria, richer the country, the more the voting power of that country, and who is the greater contributor of the World Bank has the greater voting power rights. So it is influenced by the big powers, and there is unequal voting power in World Bank. World Bank promotes liberalization of market as well as privatization. Whenever World Bank give loans to a country, it asks for the privatization of the various sectors. As the privatization of the sectors work more efficiently, the president of World Bank is always from America. Borrower country has to put spending upon health and education on hold to pay back the loan of World Bank, as the spendings on the health and education returns the wealth after a lifetime span, while the spendings on other industries and agriculture generates the money immediately. So the borrower countries hold the money to pay to invest on health and education sector, and they invest on the industries and agriculture. Uh, World Bank asks for the sovereign immunity when it gives loan to the country. Sovereign immunity means that the ambassadors or the delegates of the World Bank um, are uh, has no has not to follow the discipline and rules, and they can operate whatever they want to do in the borrower country, as and the veto power of P5 countries. As the World Bank is also under the umbrella of UNO, so veto power countries can also influence the World Bank. Know the World Bank and health. The World Bank Group is committed to helping governments achieve universal health coverage by 2030, which has the potential to transform the health and well-being of individuals and societies. Now, what are the strategies for how to improve the health of the world? The bank provides financing and policy advice to improve service delivery and expand access to quality, affordable health care. During the period from fiscal year 2002 to 2016 fiscal year means the financial year of the country. The World Bank invested 35 billion US dollars in health, nutrition, and population related areas. The bank currently manages an active health, nutrition, and population portfolio of 14.5 US billion dollars in net commitments and over 1 billion US dollars in trust funds. The World Bank Group has focused its health sector investments and such in areas that are especially vital to help countries achieve universal health coverage by 2030. Working closely with donors, development partners, governments, and private sector. Now, what are the focus areas of World Bank? World Bank focuses on ending preventive maternal and child mortality, reducing stunting and improve nutrition for infants and children, strengthening health system and health financing, ensuring pandemic preparedness and response, promote sexual and reproductive health and rights, the prevention and treatment of communicable diseases. These are the focus areas of World Bank in health sector. Now, this is the example of World Bank project in Pakistan, that is the National Immunization Support Project. In April 2016, the World Bank approved the National Immunization Support Project for Pakistan. This project costing an estimated $377 million dollars, and it aims to increase the equitable distribution of vaccine to children ages from 0 to 2 years of age. The project consists of 5 components that are designed to enhance the country's vaccination distribution to the most vulnerable groups. First component that it creates a governance structure that addresses logistics, monitoring, and evaluation systems. Second component is that it involves performance and planning and the alignment of skilled human resources. Third component is that it increases the awareness and promotes the program among Pakistan citizens. Fourth component is that it makes it possible to obtain the necessary equipment to widely distribute vaccine and increase the supply chain of vaccines. Lastly, the last component is that it includes being able to expand the program's reach and enhance research and development in this field. Now, the second part of the presentation is United States Agency for International Development. Now, the overview of USAID. USAID is an independent agency of the United States federal government that is primarily responsible for administering the civilian foreign aid and development assistance. USAID is the government agency while the World Bank is the private agency. With the budget of over $27 billion, USAID is one of the largest official aid agencies in the world and highest in the world in absolute dollar terms. Congress passed the Foreign Assistance Act on September 4, 1961, which recognized U.S. foreign assistance programs and mandated the creation of agency to administer economic aid. USAID was subsequently established by the executive order of the President John F. Kennedy, who sought out to unite several existing foreign assistance organizations and programs under one agency. USAID became the first US foreign assistance organization whose primary focus was long-term socio-economic development. USAID has missions in over 100 countries, primarily in Africa, Asia, Latin America, Middle East, and Eastern Europe. Now, what are the goals of USAID? USAID's mission statement, adopted in February 2018, is, and it is quoted like, on behalf of the American people, we promote and demonstrate democratic values abroad and advance a free, peaceful, and prosperous world. In support of America's foreign policy, the U.S. Agency for International Development leads the U.S. government's international development and disaster assistance through partnerships and investments that save lives, reduce poverty, strengthen democratic government, and help people emerge from humanitarian crises and progress beyond assistance. The various sectors where USAID works is in disaster relief, poverty relief, technical cooperation on global issues including environment, US bilateral interest, and socio-economic development. Knows how USAID give assistance to foreign countries. US foreign assistance have always led the twofold purpose of furthering America's interests while improving lives in the developing world. USAID carries out US foreign policy by promoting broad-scale human progress. At the same time, it expands stable, free societies creates market and trade partners for the United States, and fosters goodwill abroad for the United States. USAID works in over 100 countries to promote global health, to support global stability, to provide humanitarian assistance, to catalyze innovation and partnership to empower women and girls. Now, this is a quotation of USAID's policy framework, that is, our assistance should be designed to empower people, communities, and government leaders on their journey to self-reliance and prosperity. No, these are the modes of assistance, that is the technical assistance and financial assistance. USAID gives assistance to the wanted countries both in the technical and financial ways. These are the various sectors where USAID gives assistance to the countries for health related sector. These are the agriculture and food security, global health, water and sanitation, and nutrition. No, global health of the USAID. USAID's global health efforts grounded in investment in health systems, strengthening and breakthrough innovation are focused around three strategic priorities, that are to prevent child and maternal deaths, controlling HIV and AIDS epidemic, combating infectious diseases. These are the three strategic priorities of USAID. These are the fast facts of the USAID about maternal and child health. In 2019, USAID and its partners helped 84 million women and children access essential and often life-saving health services, helped protect 94 million people by distributing 47 million mosquito nets through US President's Malaria Initiative, supported over 27 million children with nutrition programs, reached more than 24 million women and couples with voluntary family planning services, in combating HIV and AIDS. It supported testing for more than 79.6 million people and life-saving antiretroviral treatment for more than 15.7 million people. And in to combat infectious diseases in 2018, USAID and its partners detected 4,600,000 cases of tuberculosis and started 98,435 patients on critical treatment for drug-resistant tuberculosis. In the field of nutrition, US multi-sectoral nutrition strategy 2014 to 2015, it's uh, though USAID focuses on all forms of undernutrition, while its major concern is the 1,000-day window of opportunity. That is the window of opportunity for the cognitive and nutrition development of the person, starting from the pregnancy to the child's second birthday. USA maternal and child nutrition programs improve health outcomes by implementing nutrition-specific interventions or that addresses the immediate health-related determinants of undernutrition that are education, water, sanitation, and hygiene, agriculture, and healthy timing and spacing of pregnancy. Now, the agency's strategic approach to maternal and child health nutrition focuses on increasing the equitable provision of utilization of high-quality nutrition services, country capacity, and a commitment to nutrition, multi-sectoral programming and coordination for improved nutritional outcomes and nutritional leadership. Now, in the field of water and sanitation, USAID helps partner countries plan, finance, and deliver safe water and sanitation services for the neediest while sustainably managing water resources. USAID will program, monitor, and report activities and outcomes over four developmental results to advance the agency goal and strategy that are strengthen sector governance and financing, increase sustainable access and use of sanitation and practice key hygiene behaviors, increase sustainable access to safe drinking water, improve management of water resources. No USAID and Pakistan in the field of health. The highlights are that pursuing a shared vision to accelerate progress toward national health targets, USA partners with federal, provincial, and district health officials to expand primary health coverage in Afghanistan-Pakistan border region. USAID is also leveraging key partnerships with academia, civil society, and private and public sectors to mitigate global health security threats and other infectious diseases. These include COVID-19, hepatitis C, tuberculosis, typhoid in epidemic-prone areas. Pakistan's accomplishments and ambitions to improve the health of its citizens have reaffirmed USA partnership in following approaches, delivering life-saving services for more than 340,000 women and children in Afghanistan-Pakistan border region, expanding access to clean drinking water, investing and responding outbreaks of HIV, typhoid, and other disease in Pakistan, protecting people from proliferation of substandard health products in Pakistan. Know the results of partnership with USAID. Pakistan decreased maternal mortality by one third over the 10 years and child mortality by 20% within 5 years. In partnership with Pakistan Health Authorities, education institutions, works, and volunteers, USAID supported efforts to deliver health services for nearly 11 million people and children and train over 52,000 people on primary health during the past 7 years. Collaborating with Pakistan health officials, architects, and engineers, USAID built clinics and hospitals, expanding access to health in historically undiverse areas. No mass campaign of a new typhoid fever conjugate vaccine. In December 2019, mass campaign with the new typhoid fever conjugate vaccine developed through a public-private partnership that influenced the University of Maryland effectively interrupted transmission. USAID and other international partners are supporting Pakistan to incorporate this vaccine as part of its routine immunization Pakistan program, and no TCV is also included in EPA program of Pakistan. Now, the COVID-19 response, guided by the Pakistan Preparedness and Response Plan and featured in COVID-19 Partners platform, USAID is partnering with National Disaster Management Authority and Ministry of National Health Services regulation and coordination to mitigate the COVID-19 epidemic by taking these actions. In collaboration with federal, provincial, and local health authorities, USAID is strengthening COVID-19 monitoring and rapid response units in all districts across Pakistan. Leveraging the expertise of Pakistan developers, USAID is introducing digital solutions to expedite COVID-19 case identification, investigation and reporting, and management, commodity procurement and distribution. It supports the design and assembly of 4 mobile laboratories, increasing the country's COVID-19 testing capacity. Uh, uh, with the collaboration of USAID, USAID provides about 200 ventilators in 64 hospitals, and it increases the critical capacity of Pakistan. It also gives trainings to the LHW for home-based care for the mild cases and supporting Pakistan as a source of COVID-19 therapeutics. USAID is engaging frozen laboratories to produce, market, and distribute remdesivir, remdesivir with a licensing agreement with Gilead Sciences. Now the recent updates. This is an article whose title is From a Privatization to Health System Strengthening, How Different International Monetary Fund and World Bank Policies Impact Health in Developing Countries. The findings of this study is that privatization of health services have become common around the world, especially in the developing countries. Several reports documenting negative effects of privatization on healthcare systems and vulnerable populations. Countries that receive loans from World Bank to privatize its social security system, for example, Mexico, had drastic changes in conditions of health. Public sector organizations faced budget reductions and led to an erosion of healthcare services, increased rates of unemployment, and lack of insurance of low-income people. The IMF monetarist strategy towards prioritizing fiscal restraint and price stability negatively impacted low-income people and increased the inequity in access to healthcare. The present policy of these two organizations that focuses on health system strengthening and especially incorporating existing vertical programs into health systems had some critics. These programs, though many were successful, might result in adverse unintended effects for the health system and non-targeted populations. Some of the developing countries are unable to implement